As some of you may know, September is National Blood Cancer Awareness Month. It's an opportunity to learn more about the different types of cancer, who's at risk, and what families should know. Here to share her personal story about her battle with cancer is Janet Jordan, and joining her is Dr. Joshua Brody. Good morning to both of you.
Good morning.
Good morning, Carly.
So, Janet, let's start with you. I want to hear about your story, and I guess if you can, a condensed story. Tell us about your journey here recently.
Yes, I was diagnosed 10 years ago as a result of a routine doctor appointment, and I was then referred to additional physicians who performed various tests, and I received 2 different types of chemotherapy. And I'm currently, in the last 3 years, I've been receiving a targeted therapy, which has kept me in remission for 3 years and with relatively few side effects.
Wow. Well, congratulations. That's what we wanted to hear. Doctor, talk a little bit about Janet's story and what you think, why it's important for her to share her story and what people need to know when it comes to different types of blood cancers.
Janet's story is a very important story in so many ways. First, because it's fairly representative of the course of patients with this type of lymphoma called follicular lymphoma. It is a low-grade lymphoma. It is extremely common in America, more than 100,000 Americans walking around with follicular lymphoma. And her story is a typical one in that that is normally how patients get diagnosed, that they are feeling basically well, but they develop an enlarging lymph node in their neck or under their arms or anywhere, and that lump doesn't go away. They get a diagnosis and then embark on a journey of treatment. And that journey over the 10 years that Janet has been living with this disease has transformed tremendously, where it was primarily based on different types of chemotherapy in the past. We still use chemotherapies, but now we have a greatly evolving armamentarium of more targeted therapies, including the therapy that Janet described, which is just a pill that patients take every day, like their blood pressure pill or their cholesterol pill, and also even newer types of therapies called immunotherapies, where we get patients' immune systems to target and eliminate their own cancers. And we've seen some awesome results with that, with giant tumors melting away and patients having some durable and long-lasting remissions.
Wow, that is great news. How many different types of blood cancers are there? Is this one of the more common ones that Janet has been dealing with?
Sure. Blood cancers are primarily divided into lymphomas and leukemias, and they are altogether extremely common. Lymphomas are the 5th most common cancer in America. Maybe don't get as much press as they should for being such a common thing, but they affect literally hundreds of thousands of Americans that are living today with those diseases, and there are many types within that. Lymphoma has 70 different types approximately of lymphoma. Follicular lymphoma that Janet has is the most prevalent type of lymphoma.
Yeah. Janet, why did you want to share your story this morning? What do you want people to know?
Well, thank you. Oftentimes people can feel alone and feel that they don't know which way to turn when informed that they have a disease, a cancer such as this one. But I'm here to say that a positive attitude and looking towards your loved ones and friends for support, and obviously finding an excellent physician to shepherd you through this process is important, and the ending can be a positive one.
Oh, we do. We like to hear that story of hope. Janet, is there or Doctor, is there a website that we can go to this morning if somebody is kind of facing a similar situation or wants to know more? Where would you send us?
Sure. There are a lot of great online resources. I think the best are these patient advocacy groups. The Lymphoma Research Foundation, their website is lymphoma.org, and the Leukemia and Lymphoma Society, the website is lls.org.
All right, Doctor, thank you so much. And Janet, we certainly appreciate you sharing your story and really hope and pray for continued success for you.
Many thanks, Carly.
Thank you, Carly.
All right, we of course